Good afternoon and welcome to another edition of Doctor to Doctor in the chat room. And we are happy to have you here with us on this beautiful Saturday afternoon. And I am happy to be here with my guest today. And we're going to have some discussions around students and parenting and teachers and COVID-19 and what next may look like, whatever that is. We think that this is definitely a relevant topic based on our current circumstances. I have today with me Mr. Shawn Boyd. He is the Associate Director of K-12 and Community Partnerships at Southwest Community College. And also Miss Nikayla Boyd, who is an education specialist and director of the Office of Community Health Engagement with the University of Tennessee Health Science Center. I have Dr. Kiffany Swift, who is an educator and a parent, and she is a family and consumer science teacher with the Fayette County Public School System. And I have Miss Caruthers, who is a physician assistant, associate professor, and assistant program director, and director of community engagement and diversity recruitment with the UT Health Science Center as well. Hello, everyone. Good to have you guys here today. I'm so glad that all of you agreed to be here for this topic because we know that schools let out in March. Not only has there been a loss of learning for many, in many cases, but there has also been an increase in some mental health issues with our students. We know that we've started reopening in many places, reopening cities. And even with that, there's some mental health concerns and there's some physical health concerns. During this isolation period, the numbers for child abuse increased. The numbers for domestic abuse increased. People are afraid, and summer is underway, and so is the fall. And we know that we're going to be thinking about going back to school. And I've even seen a press conference recently with Shelby County Schools where they introduced their task force and talked about what they're going to be doing or things that they're thinking about doing in terms of when they start back in the fall. And I think with things just ever changing, we have to ask ourselves, can we even make plans? But in the meantime, let's talk about some of the things surrounding this issue. As an educator myself, I know that being in the classroom is going to be a scary, scary thing for many, not just for the students, but for the teachers, everyone involved. So we're probably going to start with that piece. But before we do, will each of you just start? Nikayla, just tell us a little bit about who you are, what you do, and then we'll move on to Shawn.
Okay. So I, as you said, am currently the director of the Office of Community Health Engagement at UT Health Science Center. Prior to that, I was the manager for a teen pregnancy prevention program at Le Bonheur. And then before that, I spent 13 years in education. So there I was a Spanish teacher, and then I transitioned to an administrative role with Shelby County Schools. So.
And you are a mom as well.
I am a mom, and I'm praying you can't hear my children in the background.
That's okay. Shawn.
And I'm grateful for the opportunity to be on here this afternoon. Again, my name is Shawn Boyd, Associate Director of K through 12 and Community Partnerships at Southwest Tennessee Community College. I've been in the field of higher education going on 12 to almost 13 years now, and have worked at many different colleges here in the city. In my current role, I serve the K through 12 sector. We're working closely with Shelby County Schools and some other municipal school districts to really try to get students to college and provide necessary resources so when they get there, they can be successful.
Kara.
All right, so again, good afternoon to everyone. I'm Kara Caruthers, Associate Professor and Assistant Program Director of the PA, the Physician Assistant Program at UTHSC, as well as Director of Community Engagement, Diversity, and Recruitment. I have been in education 12, 13 years now. Have only though taught at, for the most part, the graduate level. Have taught some undergrads as well. Prior to me going back to school to be a big girl and become a PA, actually was an anatomy instructor for first year medical students for a couple of years. And that kind of got me on the road to becoming a PA. And have been here in Memphis since January of 2018, teaching at UT. So definitely excited. While I do not have children of my own, I do have 4 god babies. And I have a lot of friends that call and ask me questions. And I'm like, I have plants. I don't even have pets. I have plants. So good to be here today.
Thank you. Dr. Swift.
Okay, thank you for inviting me on. I am Dr. Kiffany Swift. I'm an educator for Fayette County Public Schools, Family Consumer Sciences. I teach grades 9 through 12. I've also taught middle school before. I am a mother of 3. And so I enjoy my children, I enjoy my students, I enjoy helping others as a family consumer science educator. So that's a little bit about myself. And I've been teaching for this is going to be my 10th year.
Okay. All right, guys. So here's the thing. So in education for quite some time now, there has been this push for social and emotional learning over the years. And when I think about social and emotional learning, I think based on our current circumstances, this is really a good time to kind of focus on that in these current situations. So I want you to speak to how we can teach kids the power of being heard and valued. And what advice would you offer to our kids for just saying how they feeling their feelings, and how do we address that? Because Kara, you did a webinar with UT Health Science during the Children's Mental Health Awareness Week and talked a lot about some of those concerns that even these kids, they have concerns too. So how can we address that and even speak to, whether it's with your own children or people asking for advice, what type of characteristics you've seen over this time that people are dealing with? What kinds of things are going on?
So I would say, first, I think as the adults, I think we also have to be honest about our feelings. And I think that we have to be willing to be vulnerable to children about, we feel some of the very same things that they feel. And, just, I can speak from a cultural perspective and just how I was raised in my family. The adage, children are seen and not heard. You didn't talk back to your parents, and you stayed out of grown folks' business. While I do agree that children should be able to be children, and there are certain stressors that should not be put on them to handle as little adults, because children are not little adults, they're children. I do think it's imperative that we're vulnerable and we share and say, hey, I'm scared about this too. So let's, together, let's come up with a plan of what we can do to be safer. Let's make sure we wear our masks. When we go in the store, you make sure I don't touch my face, and I'm going to do the same for you. And I think there's a way to be age appropriate, to have conversations with children about how we feel about our own emotions without making them feel like it's being weak, to feel that it's okay to be scared. Because I think we also have to realize that with children, just from a very biologic, anatomic, physiologic perspective, your brain continues to mature until we're 22 to 24. So they are children. They're still at certain ages, some fantastical thought processes that they have. but I think we can yet be vulnerable and yet be age appropriate to talk about our concerns, our fears, strategies to assess that, to deal with that. And I think that level of vulnerability can help a child feel like, hey, my mom is feeling the same way. My dad is feeling the same way about this. And hey, we have this plan. This is how we're going to move forward. And so I think changing some of the historic cultural context of how we view children and the relationship between adults and children, while yet maintaining appropriate boundaries. Not, again, your child should, in my opinion, shouldn't be your best friend when they're 11. When you're 22, 25, maybe. But, you know, and I think you can yet be appropriate and have those conversations.
To add to what she just stated, I would say it is important to let your children know that, hey, I am your parent, not your friend, but at the same time, I'm here for you and willing to hear what you need to say. And before this pandemic even occurred, I started talking to my children about I messages, teaching them how to express themselves, watching their cues. When you can tell that they're being overwhelmed with the work that the teachers are sending, tell them it's okay, it's not due today. Take a break. I give them an opportunity to go play, be children, then come back within 30 minutes, 45 minutes so that we can learn again. So as you stated, that it's important that children are in tune and in touch with themselves so they're not overreacting and doing things that they regret. And I also tell my children, when you're feeling upset, walk away, count to 10, 20, 30, whatever you need to do, because we don't want to say the wrong things that end up hurting feelings and being hurtful to others.
And Kiffany, you even have, and I know you don't mind me saying this, you have a special needs child, you know, which is really added to the work, I'm sure. And I have my grandkids here in the house with me. And, you know, I think maybe for the first couple of weeks, it kind of went okay. And then especially the boy not being able to just really be wild and you know what I'm saying, and really move around, and it just came to kind of take a toll. You know, it got to the point where it kind of took a toll. So when I think about homeschooling, because I'm even wondering, is that where we're going in some ways with some people, with a lot of people, and you know, some people have the resources, some people have the knowledge and all of that, you know, the know-how to do it. Some people don't. But the people that are having to take on that role now, that are just kind of forced into that role, what is the balance for that? Those of you that have children, what's the balance for that? Because there's just no way I can see, you know, you having kids sit down all day in this structured environment within their home, because the home is the place that they are normally accustomed to being able to be free. Nikayla, speak to that.
So we've had to be very flexible here. Our kids are, you know, on two different levels. I've got a 7-year-old in first grade and an 11-year-old in the 5th grade. And he's pretty self-sufficient. So like we can tell him, do this, do that, take your break at this time, and give him a schedule, and he can stick to it. But with my first grader, she requires more attention. So we've had to, we kind of flex our schedules. So instead of having her sit down, because we don't have to do online learning, or if we do, it's not due at a certain time, we allow her to do her work at 7 or 8 o'clock at night. We let her play with her friends during the day virtually, because that's the time that they can connect. And then if we need to do some work in the evening, we do it. And we keep in mind that their attention spans for their age, you know, having a child to sit down and do work for 6 hours is totally unrealistic. They don't do that in school anyway. You know, they play part of the time, or even if they're in high school, they have those breaks, you know, in the hallway. They have breaks when they go to lunch, PE, or some classes, realistically, they're not doing anything. So to think a child is going to sit there for 6 hours or 7 hours and do work is too much on the parent and the child. So just be flexible.
How do you guys keep them from falling into that trap? Because I think my daughter is falling into that trap of allowing the electronic devices to babysit. How do we, because I mean, I know a lot of people are really struggling trying to work at home and manage their kids. So how are you guys managing that piece?
And I would say, to add to that, for the most part, we try to put time frames on technology because, as Nikayla mentioned earlier, my son, he loves that iPad and Nintendo Wii and all those great things. And we noticed there was a time he'll get up early and he'll be on it all day and sometimes into the night. And so I think you have to be aware and also put restraints and times on those things. But it requires you as parents to kind of think outside the box, and I wanted to also say, rely on your village. So sometimes, we'll have my mother-in-law to come over to help. My mom might come over to help, and walk and help with schoolwork. And so I think that's important always to, say, hey, I can always ask for help. I don't have to do it on my own. And so I think those two things are key.
What do you guys think though about the family dynamic that doesn't have those particular supports in place? Because I was going to ask about reading and how cumbersome reading is, but then how important it is to the learning process. And I mean, to be realistic about it, we have grown-ups that never really learned to read, so it would be very difficult. We have educators here, so all of you guys could actually help your child. What do you think about those people that don't have that particular family dynamic? What can we do to support those particular families and children?
Since my children and a lot of other children have a thing for electronics, when I do not have someone to assist me, while my mom do come over and help, but when she's not available to come over, I might get the YouTube and go to a learning video or learning something for the kids. And I let them know, hey, we're going to learn about math. We're going to learn about numbers. We're going to learn about reading, sight words, whatever it is. I let them know what we're learning, and also letting them know that I'm incorporating reading with your electronic time. So this is giving you a break from the written work, but at the same time, this is your 30 minutes, your 45 minutes for the electronic time. And then once they are done learning for the day, I give them an opportunity where they can watch a few other videos of their choice. But at the same time, I don't just leave it open for them to pick and choose. There are some things, some balance there that we both have to be happy with what we're watching.
Let's talk about what some of your greater concerns are as parents, as educators, as healthcare providers. We're going to talk about that when we come back from break. We're going to go to break. We are here on 94.7 FM, and I am talking with this lovely group about COVID-19 and school and students and parenting. We will be right back in a moment. And we are back on 94.7 FM, the Gospel Giant, and I am still here with my panel, Ms. Nikayla Boyd, Mr. Shawn Boyd, Dr. Kiffany Swift, and Ms. Caruthers. Tell me what your greatest concerns are right now, based on COVID-19 and all of the things that are so uncertain that come with COVID-19. What are your concerns?
I know, coming from a college level, we have at Southwest specifically, we have almost 10,000 students. And so many of our students have chosen to come physically on campus just so they can have that connection with their teacher, that sense of engagement, sense of belonging. And so a lot of those students have expressed, because they were kind of forced to go on an online format. And so we're in the process of trying to plan, and I think you mentioned this earlier, you're planning, but you're still in that gray area because you just don't know what's going to happen. And so we're trying to do a hybrid model for the fall, where students, might be on campus some, they might be off. But even with that, we have a lot of students that are still uncertain. So we just try to update them as much as possible, be transparent, and just, again, provide the latest information. So as things kind of break, we'll keep them up to date so they can make the best decisions.
Nikayla?
I'm, especially working in the Office of Community Health Engagement, some of our goals have been to really raise awareness around the issues that communities of color have been facing since coronavirus. And I'm extremely concerned about the neighborhoods who just don't have access or infrastructure, just in case we have to do virtual classes. Like you said, most of us are either educators or, we're able to help our kids. I'm extremely concerned about parents who don't have access to the internet or may not have the intellectual ability to help their children. And I'm really hoping, I know Shelby County Schools is working hard to try to get technology to every child. And I know that they're working on getting the teachers trained so that they're able to use the technology for the students. But I feel like some kids are going to fall through the cracks, and I'm hoping that somehow we can figure out how to help those kids. Because, like you said, you try to put them on a schedule, but if nobody's there holding them accountable, or if a parent is an essential worker and they're working all day when the child should be logged on, what are we going to do? Or how can we come together as a community to address that problem?
So Shawn was just talking about, the planning and, when we think about what's next, how do you think we can really be proactive about what's next when we really don't know? We're putting all these things in place, and Nikayla, and we talked a lot about the technology stuff, all the kids having technology and making sure that they all have access to the internet, because what's the use in having technology if you can't get internet and all that. But if you put all that in place, and then maybe the pandemic ceases, I don't know, but how can we really be proactive and we don't know?
As a parent and educator, I know all parents are not created equal. All parents are not going to be able to educate their children because they weren't prepared for that. But I think as a parent can help just in case, no matter what happens, whether we say electronic, if we go back into the classroom, by providing structure for their children while home. Because as an educator, that's where a lot of time is lost in the classroom because the children don't know how to, pay attention and all that good stuff. So if the parents would just kind of focus on structure, getting their children to obey, follow rules, it'll help.
And I would say, I guess I'm zooming out a little bit and doing some projection. I think COVID-19 has blatantly uncovered what we already knew, that there's inequity in education, there's inequity in food availability, there's inequity in healthcare. And so I guess what I hope as we are doing things that definitely help our children in this time, as you said, showing them structure, helping them understand schedules, helping them using technology for reading, for learning sight words, for educational things, utilizing the technology they do have access to. My big thing is I want us to plan on changing the narrative moving forward. Like, again, the issue with food insecurity. It is a shame that the school is the place where some kids have breakfast and lunch and that's the only food they eat, right? That should not be in this country. The fact that there are very gross food deserts in this city of 1.5+ million people all these educated folks, all these healthcare systems, and we have children that do not have healthy, nutritious food. The fact that we have certain parts of this city and this metro area where businesses aren't paying taxes, where there is environmental racism, where things are being dumped into the creeks, into the sewer system that are emitted in the air. So that stuff, I hope this enrages us to do our part with not only voting, but holding our officials accountable, whether that's the school board, whether that's medical systems, higher education. Like, I am hopeful that this really exposes the years of the generations of disparities. And I think we have to use this as fuel to demand better. Like, I think we have to collectively use our voices. This next generation of children should not suffer because of the blatant structural, educational, environmental racism that existed in the generation before us. And so that's what I hope from a broader sense. I know we are dealing with right now, this is what's going on, but zooming out, like, we have to demand different. And there's enough of us with our collective voices, with our tax dollars, that we can demand different. Like, our kids deserve that. Like, my god babies, they deserve to live somewhere where they're going to be taken care of, where they know that they can only get clean, wholesome food, nutritious food at school. That should not be. And so yeah, that's my hope. I'm gonna hop off my soapbox.
No. So, I mean, you spoke of the disparities, and there's just so much that we could be talking about just today. So much just happened over this weekend that it's just put this huge cloud over, and I don't want to change the topic, but just put this huge cloud over our race. Things are just happening at an alarming rate. And I even think of that, because of the times in which we are living. And I think in terms of our children going back to school, and, what it could look like in other ways, not just as it relates to COVID-19. Shawn, talk about, from a higher ed perspective, talk about the campus closures or reopening of campuses and what you may know about that. You had mentioned the hybrid model, and you talked about how some students are really wanting to have that interaction and come on campus. Are students struggling, to do stuff online, from an academic perspective? Or in any other way? Are there immediate financial challenges? What's going on from a higher ed perspective?
Yeah, so during this time, we have been very fortunate. Our academic vice president, academic affairs, during this time, not only did the students suffer a little bit, we had some professors that had been teaching for 30-something years who had never used any piece of technology. It was just straight lecture based. They record in a grade book like back in the day. And so when this happened, they had to really adjust to this new norm. And so during this time, we wanted to make sure going into the future that we're all prepared. So now all faculty at Southwest, they are required to take an online teaching certification. And it's just kind of make sure that faculty, number one, they're used to the technology. And number two, it does take a very specific teaching style when you do teach online. And so, hey, if you notice a student that, was on a question for 20 minutes, why was that student holding off for 20 minutes? I may need to give them a call or have a meeting or different things of that nature. We are also making sure when our students return in the fall, one of our charges by our president, Dr. Hall, she wants every student on our campus to have a laptop. And so we always knew that was kind of an issue. When this happened, we had students that were in the parking lot asking to, lease out laptops, or, hey, can I sit in the parking lot to use the Wi-Fi? And so we knew that a lot of our students were struggling with technology. And so we're trying to just take the proactive approach instead of just kind of sitting around during this time. What can we do to better prepare our faculty, to better prepare our students? So again, if we have to go back into this in the fall, we'll be better prepared to deal with it.
Okay, so when they had the press release with Shelby County Schools, they talked about they will make sure the kids have the technology. They'll make sure they have access to internet. They may possibly do staggered scheduling to help with the social distancing piece. That the teachers are all being trained. How realistic is that? That over the summer, I mean, because we have a lot of younger educators, the millennials, but, I see you laughing, but how realistic is it that we are going to have everyone trained to deal with online learning, possibly deal with the technology piece? How realistic do you guys think that is? Although I know we have to do something, we have to be prepared to do something. So I'm not suggesting that we don't. I just wonder how realistic you think it is.
I don't think it's really realistic to have everyone prepared when we return. And the reason being is people learn at different rates, and with everyone living in different areas, they may not be privy to high-speed internet and all that good stuff. So they're going to become discouraged. And I'm so thankful that when I was working on my undergraduate degree at MTSU, my professor for my major courses, and also she was my advisor, although the class might have been listed as a face-to-face class, she didn't allow us to come in every day, every week for class. She made us have to do some work online. And she told us it was because she had taught abroad and she wanted us to be prepared. So as life happens, because life happens, and life happened with me during 3 of my degrees, I ended up getting pregnant and I had people to tell me that I wasn't gonna finish. But because I was prepared for online learning, I was able to finish my 2 masters plus my doctorate while being pregnant. So it wasn't something that happened overnight to be acquainted and prepare for online learning. It's something that happened over time. So with these few months, few weeks that we have before the schools open again or the school year open again, I don't think it's realistic that everyone will be prepared.
So Kara, I read this article that indicated the risk of reopening schools should be properly balanced with the risk of keeping them closed. And that was all due to the mental health and well-being of children. Would you speak to that? What would that even look like?
So I will say this: I am very empathetic because what I realize is there are people that have struggled with mental health issues before this happened, and this pandemic has exacerbated that.
Mm-hmm.
And again, because from a cultural perspective, we have said we valued mental health, but it really hasn't been until these last 3 to 5 years I think we've put more of an emphasis on mental health. So I understand that, but while understanding that how we phase in has to do with rates of infection, has to do with, you've heard us talk a lot, medical folks talk about flattening the curve. I am concerned because I don't know, I personally feel that we opened up a little bit too quickly. Just with looking at some of the numbers, looking at some of the public health recommendations of how we open up, I'm not quite sure we've really followed that. And again, I'm talking about national, I'm not talking about local, I'm really talking more higher level national public health kind of traditions and recommendations. I don't think anyone has followed that. And so there is a balance between reopening, having children back to school, to assist them because of mental health concerns, I guess if they're back in the school system and there are some mental health issues, I am not well versed on what support is there in non-COVID times for children to have mental health issues. Like if this child had mental health issues before we were quarantined, what steps were put in place to assist those children then? Yes, the pandemic has exacerbated that, but what resources do we have? What resources do the schools have for mental health assistance for children once they return, because they are yet going to have mental health issues even when we reopen? So what support is there? Do we have enough, whether they're licensed social workers, whether they're clinical psychologists, whether they are nurse practitioners, PAs, MDs that work in psychiatry? Do we already have enough without COVID to help and assist these children? Do we are the school systems prepared to hire more therapists? Are they prepared to require that children, as they come in, we do screening? So there are some things in the primary care world that I do on some of my patients minimally once a year, depending on their diagnosis. I may do it every time they come in, where I'm doing a quick screening on their anxiety level and their depression level. It's a quick, like 2 minutes. Are schools prepared to do that evaluation on children as they return, that they can then monitor those children and send those children to the professionals that can assist them? And so that's kind of where I'm at. It is a balance. There's no perfect answer, but I think we have to think about the preparation of reopening. Those children are yet going to have mental health concerns. What are we going to do to help them?
Before we go to break, guys, do you think that we are going to have a shortage of teachers when we return?
Yes.
You do? Do you think we're going to probably have a lot of homeschooling in the future?
Yes, I think we will.
Go ahead, Nikayla.
I think for those who can, very likely will homeschool or will reach out to homeschool teachers. I'm even concerned about how many teachers might retire, if they're able. You may have quite a few vacancies, but I don't think it will be a mass exodus, because I know that it's kind of difficult to find a job right now. So I think some people will still be there, but those who can, they might go ahead and leave.
Okay, we're going to go to break and we're going to come back. And I want you guys to just offer some tips to our listening audience for parents, teachers, students, whomever you think that we might be able to offer something to help navigate through this time of uncertainty. We will be right back on 94.7 FM. And we are still here on 94.7 FM, The Gospel Giant, and we are talking about COVID-19 and schools and students and parents and teachers and how it all fits together. Kara, you had talked just a little bit about, in your opinion, we're kind of opening things a little bit too soon. And if that's the case, I could definitely even seeing that having an impact on the opening of schools. Do you think we should be gearing up to try to open schools versus maybe just prepare to do things online? What do you think it should look like, just based on your professional background and things that you've seen and heard?
So I don't think there's anything wrong with planning, right? I think it is imperative that we plan. We have, as my mother used to say, an A, B, C, and D plan, just in case. But I also think we do have to look at the numbers. Like, some of the earlier recommendations from the CDC was that communities reopen when there had been a 14-day downward trend of reported cases. And as things were opening up just across the United States, there was not one municipality that met that. But yet we opened, and I do understand it's a precarious balance of mental health, of education, of finances, of economics. I definitely understand that. I'm just probably more cautious. You know, I think of my 70-year-old father. You know, we had to get that brother not to go to church. And he's still back home in Nebraska where the governor did not shut things down. And he was still going, and we was like, sir, what is you doing? Me and my sisters had to get him together because he is in that group, that the age group. He also has some health concerns. And so I was concerned for him. And so we put some things in place. And so even though that's anecdotal, I think we do have to look at just history. A lot of people are comparing this to the influenza epidemic of 1918. Mm-hmm. And when you look at that historical context, the cities, municipalities that shut down quicker and for longer amounts of time did not have the number of deaths. As well as when that second surge came, it was not as horrific to those communities. And so I think we do have to look at historical context. I think we have to also ensure that we are understanding science and how science works. This is not going to magically disappear. I do also understand that with the way they believe this virus spreads, being in a big open area is actually more beneficial than being in a small enclosed room. Definitely having good air circulation and filtration, all of that makes, if you will, the number of particles of virus more diluted in bigger particles of oxygen, right? And so all of that, I think we have to take into account, as well as just tracking, as well as testing. No one is really widespread testing at this point. And so I think having that information, more of that information will help us make better decisions.
Is there any more information out there about, children and how rapid they are actually getting the disease, and, are they more asymptomatic? Because that seems to have been kind of like a gray area as well. And then when I think about the schools and people, the teachers that are over a certain age teaching these children and being exposed to them, and they may be, asymptomatic or not.
Right. And so some of the early information had been children didn't have the same level of seriousness, or as far as their symptomology wasn't as severe, I'll say it that way. However, in New York, where we know that was a big hot spot, there has been some clinical manifestations that they've seen that are concerning. Certainly skin changes, skin presentation, but also something that mimics another more serious illness. We're seeing some of those same things with children with COVID. Again, it's a very small percentage, and it's not every child. Just like we know the majority of people that do contract COVID-19, they recover. But we're really thinking about that 10-15% overall that don't recover or have more serious side effects. And that's really the folks we're trying to protect.
So yeah, I was out this weekend with my father, and I have to give him a pat on the back. He's 77, but he's also a Tennessee state legislator, and he stayed at home before they said stay at home. It was almost funny. He was like, nobody has to tell me anything. I'm gonna stay right here. Speak to the disproportionate impact of COVID-19 on ethnic groups, because we do know that we are more susceptible to this disease.
And it's really because of some pre-existing health conditions that we have. So That's diabetes, that's hypertension, that's asthma, that's for those that smoke or have that exposure, COPD. So a lot of what you're seeing of those that are dying and having some of those severe effects, not everyone, so I'm not saying 100%, but a good majority, they have underlying health conditions. So again, this goes back to the broader conversation about health disparities. Why do we have so many health disparities? It's not because we're Black, because there is no gene for race. I'm brown on the outside, but ain't nothing in my DNA to say, oh, she Black. Because what does being Black mean other than how I look? I got the year-round tan going on. That's about it. I'm just saying. So I think there's a broader conversation we have to have. Why don't certain ethnic communities trust physicians or PAs or nurse practitioners? We know a historical context of the Tuskegee experiment. There is a litany of documentation of harm that has been done by the medical community to communities of color, to poor communities, to other othered communities. Like, there's just this documented history. And so I think the bigger context for sure is we can't just say, oh, well, y'all are overweight. Black women are more likely to have overweightedness or obesity. Well, we also know that there are certain communities of color and disenfranchised communities that have higher stress levels. We know that higher stress levels causes more cortisol. More cortisol causes more abdominal girth. More abdominal girth impacts your blood pressure. You're having uncontrolled blood pressure impacts your kidney function, right? So there's this cycle that, again, I am hopeful that this exposes. We got to fix stuff in our country, in the city. We have to fix stuff in the medical community to ensure everyone can come, receive primary care, receive preventative care, receive a provider, a doctor, a PA, a nurse practitioner that is going to hear them, acknowledge what they say, not downplay, not tell them they're lying, not telling them that they're non-compliant when we never took the time to explain their disease process to them. Baby, why am I prescribing you metformin for your diabetes? Because, hey, this is what's going on. We have, in my opinion, failed to teach basic science, basic anatomy, physiology. How can I expect you to partner with me in your healthcare when you don't understand your body? And so this is all cyclical. This is all interconnected. This is not isolated. This is something that we're going to have to use a multi-pronged approach to fix, but everyone has to be willing to fix it. I know I have a big mouth and I like talking about this, but I know not everybody is as passionate about it as I am, or there's a lot of folks that don't even acknowledge this is a problem. And so that's the first step. We got to acknowledge this is a big problem. And it's going to take some years and some dedication for us to fix it.
Yeah, I agree. I want each of you to just offer some tips for everyone, just based on, your background or just based on what you've had to do as a parent or in your profession, for everyone that's just navigating through this process and through this time of uncertainty. We want our kids educated. We want them to get their education, but we want everybody to be safe as well, and we want everybody to be alive and healthy. And we, as Kara said, we've got to fix these things and figure out how to make that happen and know what it looks like to make that happen. Because usually, I say, and voting is so important. And I just wish that I could do some kind of voting drive or something, because it's so important. And our college students, Shawn, if our high school students, I think I saw a meme or something that said, hey, if you really want to make a statement, then you vote. You lost your graduation days and dates, and all your plans were kind of shattered, but vote. That's how we change it. Vote. That's one big impact on it. But offer some tips, if you will. We'll start with you, Shawn, and we'll move to you, Kiffany. Did you want to add something, Kiffany?
Yeah, I would just say to the college students, the recent graduates, just be flexible. I know the number one question I get is, college is a huge investment. And so a lot of parents and students are saying, hey, I'm about to spend 25, and that's on a low end, 25,000 for college, but I'm uncertain if I send my student, across the state, they might be back. I might lose dorm money or whatever the case may be. And so always just explore all your options. Of course, a community college now, for the most part, is free in the state of Tennessee. Your credits will transfer to a 4-year institution if you want to, stay closer to home, maybe the first semester or the first year. And then also don't be afraid to just ask for help. One thing for my professors, we have leadership calls weekly, and the number one complaint is that, hey, I have office hours online. I even try to call some students. I've gave them my cell phone, but a lot of times students are still not reaching out. And of course, we know that it comes from many different places. They may not feel comfortable, but students, you pay us as higher ed professionals. If we don't have students, we don't have jobs. So make sure that ask for help. We even now have a mental health counselor on staff. We only have one for basically 10,000 students, but it is a small start, and hopefully her schedule has been packed. We have also did a partnership with University of Memphis where we can send our students over to them because they do have more mental health counselors. And so students are reaching out and saying, hey, I need somebody to talk to. And so continue to ask for their help. This is your education, so drive it.
Yeah. Thank you, Shawn.
Okay, my tip would be to utilize this time to take it back to the basics. We've heard on several commercials that staying home can be hard, but there are some payoffs to staying home. So utilize this time to take it back to the basics with family time. You can utilize this time to learn to garden. You don't have to have a big place to start your garden, but start a garden so that you know that you will have those healthier alternatives to have something to eat, so that you don't have to go out all the time. You can utilize this time.
Let me just say, you are Nikayla's friend. Go ahead.
You can utilize this time to teach the children those basic skills that they need that was once taught in home economics. Learn to do laundry, learn to properly make the bed up. A lot of people don't know how to fold sheets and all that good stuff. So utilize this time to really teach your children and your family members to prepare a balanced meal, to proportion foods, just do some things that'll be long-term beneficial for you. So utilize this time to do more than just get on Amazon and shop, but do some things that are worthwhile.
Nikayla?
Yes, I agree. Definitely. I was going to say some of the same things. Teach, let's work to teach the kids life skills. Like we're working on counting money, just basic things that we don't really have the time to do when they're in school. Learning how to cook, like she said, make the bed, clean the house, just things that you really don't have time to focus on. So that's one thing. And the second thing, get tested. A lot of places right now are offering asymptomatic testing. You can check the city website, you can check your county's website, but please go and get tested. People are begging for patients or whoever to come and get tested, and people are not showing up. So please, 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 a lot of places you don't even have to have an appointment anymore. Check before you go, but most places will not turn you away. They'll let you make your appointment right there. So please, please, please get tested. Please continue to be socially distant. Please wear your mask so that we can get back to basics, or back to business rather.
Yeah. Thank you, Nikayla. Kara?
All right, so I'm gonna piggyback on get tested. Even if you are asymptomatic, get tested, because we need to know that information as well. But I would say for the adults, definitely make sure you're taking care of your mental health. As the saying goes, you can't pour from an empty cup.
Mm-hmm.
So when the little ones get in the bed and they finally go to sleep after you have them run around the house 15 times to wear them out, if it's you downloading an app. So there's a app that's geared towards Black and brown folks called Liberation app. It's a meditation app that's very specific. That they have some really good meditations, things to listen to for soothing, to get your mind back at ease. There's also Insight Timer. is another app that I use. If you are fortunate to have an established relationship with a mental health professional, if you can do telehealth therapy sessions, please do that. I know Talkspace is one such group that does some telehealth therapy sessions. I believe they were given a discount for frontline essential workers. The other thing, there's a podcast and website. There's a therapist out of Atlanta, and it's called Therapy for Black Girls. I follow her on IG. I listen to her podcast, and she has been talking about some very specific COVID-19 related things. Just how do you bring peace? How do you bring calm? And I think for the adults, you're trying to be strong for your children and your loved ones, but you have to make sure you take care of yourself. And definitely for your kids, what was mentioned before, utilizing technology, YouTube learning. If you have a library card, you can download the Overdrive app or the Libby app, where you can actually download books. You can also download audiobooks. I Googled real quick, Black books for boys, Black books for girls, like some essential books. And there's a list of literally 60 books that are geared towards Black children, that again affirms them. There's pictures that look like them. I think it's imperative we affirm our children, even knowing that there's these disparities and imbalances in place. I think it's our job as a community. We have to affirm our kids and let them know that they matter, beginning at home, at church, other social organizations, because they may not be getting that at school. So I think that affirmation to our children from all of us, because again, the old saying is it take a village. So again, I got God, babies, and plants, but I want to be part of the village, because we have to affirm our children. If we don't do it, they're going to go out there thinking that they're not valued, particularly in this time with all these disparities, but they're valued and they're needed for our next generation.
Yeah. Thank you all for being here today. I thank you so much, and I hope that definitely you've given our audience some great takeaways, and I hope these are things that people will keep close and use this information to navigate through this time. We ask that you stay safe, stay prayed up, be supportive of one another. As we hear all the time, we're in this together. We'll get through it together. We will see you next Saturday at the same time at 2 p.m. on 94.7 FM, The Gospel Giant.